Good afternoon, everyone. My name is Dr. Urvi Mehta. I am the tutor in the Faculty of Physiotherapy. Today's subject is the electrotherapy and the topic is microwave diathermy. Here, some are the properties of the microwave. Microwave diathermy, its vehicle in the short form MWD, is a form of electromagnetic radiation lying between the short wave and the infrared waves. Microwave diathermy does not penetrate as deep as shortwave diathermy. That's we call say if we have to give the deep heating, so we can give the shortwave diathermy, and if we have to give the superficial heating rather than the shortwave diathermy given, we can use the microwave diathermy. The energy is first absorbed at the surface of the body, that is skin, and a part of it penetrate and absorb in the deep tissue which are going to be treated. In generate a strong electrical field and the relatively little magnetic field. It can generate the strong electrical field and may relatively little magnetic field can be generated. Now, what are the frequency and the wavelength of the microwave diathermy? The microwave has a much higher frequency and a shorter wavelength than the shortwave diathermy. The general frequency of the microwave is between 300 MHz to 300 GHz with the wavelength of the 10 mm to 1 meter. Here, the therapeutic microwave generates used frequency of 2450 MHz with the wavelength of 12.25 mm. Here, the wavelength and the frequency may be different in the various condition. If it is chronic duration or it is the acute duration or subacute duration, it can be vary from each patient and each condition. Microwave production and device. The generator used to produce a microwave has three main components. First one is the multi-cavity magnetron valve. Second is coaxial cable, and third one is the director, or we can also say the transducer. Now we see the mechanism of the microwave production. The magnetron produces a high frequency alternating current which is carried by the coaxial cable to the transducer, that is director. In this figure, you see the coaxial cable. Here have the director also. This is the coaxial cable. You can see here. In the middle, it can write also the coaxial cable. The coaxial cable transmits the energy to the director, whereas a radiating system comprises an antenna within a reflector that is used to direct the microwave to the patient. Okay, so what happened? The coaxial cable transmits the energy to the director. Here, this is the coaxial wait. Here, the coaxial cable cord is the transmitter, magnetic electrical field coming, electrical current coming. It is a reflector. The refractor can generate and activate the director and given to the patient. Microwave production and device. The alternating current in the antenna produces the electromagnetic field that is directed toward the tissue by the curved reflecting director surrounding the antenna. The presence of a director and the short wavelength of a microwave radiation allow this type of diathermy to be focused and applied to small defined areas. So we can this apply for the small area and also some for the large area. It can based on the director. Therefore, this device can be useful during the rehabilitation when only small areas of the tissue are involved. Directors used in microwave applications. So here somewhere the directors have the different types in the shape: circular directors and the rectangular directors. Circular director, in that the heating pattern is more intense and outer portion than the center. Means you can see in this figure, the first one figure, the outer portion is more heating than the center portion. Means surrounding the circle can heating more, and in the center the heating get less. There are small and large, also have the large circle or also have the small circle shape of the directors. Rectangular directors. In the rectangular directors, the heating pattern tends to be more contracted in the center of the treatment area. Means we can say in the figure also, right? Opposite the circular director can center get the more heating and the surrounding surface not that much heating got. Means heating got but not the so much effect only produced in the center. Now the biophysics of the microwave diathermy. MWD tends to be reflected and scattered at the different interfaces as air skin fat and the fat muscle, which limit its penetration into the tissue because of the spreading of the microwave. The superficial tissue tend to be heated more than deeper tissue. Means this superficial tissue is more heated, deeper tissue is gradually heating. Means if the patient is so much sensitive, so he or she will feel the heating in the superficial tissue, so maybe she can not get this effect or she cannot got the treatment. Depth of the penetration depend on the frequency of the wave and the medium. The effective penetration of the 2450 MHz is approximately 3 cm. Means its penetration approximately in the 3 cm can go to the depth. So it can heating feel in the 3 cm. Mechanism of heat production by the MWD is the same as SWD. Likewise, we learn in the SWD session before already learned already. Therapeutic effect of the microwave diathermy. First is pain. Microwave diathermy is useful in the treatment of traumatic and rheumatic condition affecting superficial muscle ligaments and the small superficial joint. Muscle spasm, which may be reduced directly by the MWD or may be reduced by the relieving of pain. Inflammation. In the inflammation, the microwave diathermy reduces the inflammation by the increasing blood supply that will increase the venous return from the inflamed area and aids the reabsorption of the edema exudate. Means can inflammation reduce. Other therapeutic effects: delay healing. Microwave diathermy promotes healing of open skin by increase the cutaneous circulation. Means it can be help in the increase in healing. Infection. Microwave diathermy can control the chronic infection by the increasing the circulation. If we increasing the area of giving heating, the circulation area we are increasing, then we can reduce the infection, chronic infection. It get time but can reduce. Fibrosis. The heating effect of the microwave diathermy increase the extensibility of the fibrous tissues such as the tendons, joints, scapula and the scars. So the heating effect of the microwave diathermy that the microwaves come that can relieve and given nice treatment in the fibrosis. It's effective to give. Indication of microwave diathermy. The clinical indication for the microwave diathermy are more or less similar to those for the SWD, means shortwave diathermy. Both are the similar. Slight there are the difference that we can learn in this session. Microwave diathermy may be preferable to the shortwave diathermy when the more concentration or the localized heating is needed. If we want to concentrate it more or the localized heating is more needed, then we can give the microwave diathermy. Musculoskeletal disorders like the sprain, muscle or tendon tear, strain, degenerative joint disease, joint stiffness in the superficial joint, capsular lesions. These disorders we can give the microwave diathermy. Superficial inflammatory or the infective conditions like the tenosynovitis, bursitis, synovitis, abscess, infected surgical incisions, like this condition also we can give. Contraindications: over malignant tissue, over ischemic tissue, over wet dressing and the adhesive tapes, metal implants, pacemaker, over the growing bone, male gonads. Repeated irradiation can cause the sterility, hemorrhage, impaired thermal sensation. In these all conditions, we cannot give the microwave diathermy. It can be happen the adverse effect and it's the contraindication. It's the condition gonna be worsen. Recent radiotherapy, hypersensitivity to heat, acute infection or the inflammation, venous thrombosis or the phlebitis, pregnancy. Heat applied to pelvis or the hip in pregnancy may cause the hemorrhage or the miscarriage, acute dermatological condition, severe cardiac condition. These all conditions we cannot give the microwave diathermy. What are the precautions? Same as the SWD, we are already learned in the SWD session, but it is recommended to avoid the presence of the metal within the treatment field 4 feet because of scattering and the reflection of the microwave diathermy. Due to the scattering and the reflection of the microwave diathermy to the surrounding environment, it has been associated with the high incidence of the miscarriage among the female therapists who regularly operate these units than SWD. The eyes, MWD may cause the cataract, obesity. MWD with 2450 MHz, there is a danger of the producing and excessive heat in the subcutaneous fat layer. Also the burn, but there in the increasing of the risk of the excessive heating and the burning with the using of microwave diathermy due to the shallow depth of the penetration. Also the reflection at the tissue interfaces, potential standing waves. Dosage of microwave diathermy, duration of treatment is 20 minutes is optimum intensity. The patient should feel mild and a comfortable warmth and frequency daily or an alternative day. This the microwave diathermy machine. Here we can show the both the circular and the rectangular director. Here the placement of the rectangular, circular. Somehow we can use the two electrodes, two rectangle directors also, and Thank you for, if you have any query, any um, suggestion, any question, you can ask. And thank you.